Good morning, everyone, and welcome to our second presentation of the CGN Global Nursing Impact Series. Through this series, we aim to create a platform for our nurses and global partners to share their remarkable work, highlight their valuable insights, and inspire our global community. I'm Rebecca Silvers, the director of UCSF Center for Global Nursing, and I have the privilege of introducing this month's speaker, Bhawana Regmi. Bhawana, who I'm so excited to have here today, is an accomplished nurse and educator with an impressive academic credentials and professional expertise. She holds a Master of Science in Nursing from Koirala Institute of Health Sciences and a Bachelor of Science in Nursing from Kathmandu University School of Medical Sciences, where she currently serves as faculty. She brings extensive experience in critical care, medical surgical nursing, and mental health nursing to her students, preparing the next generation of nurses with knowledge and compassionate care. Bhawana concurrently holds a clinical appointment as the nurse manager for the Adult Intensive Care Unit at Dulikhel Hospital, Kathmandu University Hospital, where she leads the Critical Care Nursing Fellowship, drives quality improvement initiatives, and champions her team leadership development through dedicated mentorship and support. Bhawana is also an active member of the Critical Care Nursing Association of Nepal and continues to advance research in critical care, cardiovascular nursing, and patient safety, in addition to being a valuable member of our leadership team as part of CGN's Global Nursing Advisory Council. Please join me in warmly welcoming Bhawana Regmi. Oh, Bhawana, you're muted. Let me help you. There you go.
Do you hear me? Thank you. Thank you so much for the nice introduction. I am not that experienced, but I'm learning. And hello and namaste, everyone. I'm Bhawana from Nepal. And today I'm here for the presenting or for highlighting what critical care nursing is in Nepal and in my Dulikhel hospital where I'm currently working. So the topic for today's presentation is Advancing Critical Care Nursing in Nepal, Dulikhel Hospital Experience. Before going to the critical care nursing, I'd like to introduce you about Nepal. It is nestled between two giants, China and India. Nepal is a small but vibrant country located in South Asia. It is also known as the land of Himalayas. It's home to Mount Everest and rich cultural diversity. Though it occupies a tiny spot on the global map, Nepal plays a significant role in global diversity and heritage. And I'd like to discuss about a brief history of critical care nursing in Nepal. Critical care nursing or critical care is not that old in Nepal. It's quite a new area of health care in our place. The journey of critical care in Nepal started modestly but significantly. It was started in 1973. The first ICU was established at Bir Hospital, Kathmandu. It is a government hospital and it is located in the capital city, Kathmandu. It was started with just 5 beds dedicated to medical care. And for about nearly 2 decades, it was only the unit that remained in the entire country. And today, this legacy continues to inspire the growth of critical care nursing, building on the resilience and dedication shown in those early years. And Critical Care Nurses Association of Nepal. Rebecca also said that I'm also an active member in the Critical Care Nurses Association of Nepal. It was founded in 1916 and is dedicated to empowering critical care nurses across Nepal by enhancing their skills and knowledge. And it is also the member of World Federation of Critical Care. It promotes high-quality critical care service nationwide. Through continuous education, networking, and advocacy, the association strives to elevate the standards of care for critically ill patients, ensuring that critical care nursing in Nepal meets global standards. And now come to the critical care nursing in Dulikhel Hospital. Dulikhel Hospital, you can see in the map, It is a small city in Nepal. It's 30 kilometers away from the capital city, Kathmandu Valley, and is situated at the altitude of 1600 meters from sea level. And Dhulikhel Hospital is located in Dhulikhel city. Dhulikhel Hospital is renowned for its commitment to advancing critical care and expanding access to healthcare in rural and semi-urban areas. And it also serves as a training center, demonstrating how critical care can be effectively implemented in resource-limited settings. And Dhulikhel Hospital's initiative extend beyond just providing care. They include research, education, and community outreach, making it an influential institution in the evolution of healthcare in Nepal. Now, I'd like to show where Dhulikhel Hospital is located. It is located in the junction of main road, which connects major northern as well as southeastern part of Nepal. So, Dhulikhel Hospital receives a major or a large number of trauma victims. So, critical care nursing it has been advancing at our place, as it has become one of the referral center for the trauma patients. Now, I like to show you where I work. Kathmandu University School of Medical Science and Dhulikhel Hospital. Dhulikhel Hospital is a teaching hospital for Kathmandu University School of Medical Sciences, and this is the place where I work. Dhulikhel Hospital was established in 1996, and we are growing. We are still in the growing phase. It was started with 50 beds, and now it's 480 beds at our hospital. Now I'd like to tell about the journey of ICU at Dhulikhel Hospital. It was started in the year 2004 with just 4 beds and a dedicated team of 5 nurses. And to meet the expanding needs of critical care, today we have 3 specialized ICU for adult patients offering Level 1 ICU's 9-bed adult ICU and 3-bed surgical ICU. And we have Level 2 7-bedded medical ICU. And we have dedicated nursing team. A robust team of 55 nurses keep our ICU running smoothly, and which include 1 nurse manager with a master's degree, and which is me, 2 nursing in charges and 12 nursing officers with bachelor degrees, staff nurses with 3 years of nursing education after high school, high standards of care, maintaining optimal nurse to patient ratio. We usually maintain 1:1 nurse and patient ratio for mechanically ventilated patients, whereas for non-ventilated patients, we have 1:2 nurses. And in the year 2023, the total number of patients admitted in Level 1 ICUs were 960, and the most common diagnoses for admissions to ICUs at our place are acute exacerbation of COPD, that is the most common one, and others include organophosphorus poisoning, emergency laparotomy for penetrating as well as blunt abdominal trauma, upper gastrointestinal bleeding, pancreatitis, subdural hematoma, because of the trauma victims, and rickettsial fever. It is in the growing phase, and these days we are also having the dengue fever. And this is the setup of our ICU. We have 13 bed in Level 1 ICU, and we have wide spectrum of disease like medical, neuro, trauma, post-surgical, and obstetric cases. And we have a team collaboratively working like anesthesiologist, physiotherapist. As at our place, we do not have the respiratory therapist at critical care unit. That's why physiotherapists work for that. Pharmacists, nutritionists, and nurses. And we have an open ICU, and the department under which the patient is admitted, the patients are looked over by the same department. But the treatment and changes are being done by the anesthesiologist and critical care doctors. And our ICU, though it's new and it's in growing phase, we have many strengths regarding our ICU, like we have 24-hour service to the critically ill patients with minimum resources. And most of our critical care nurses are trained on basic for nurses in critical care, infection prevention, basic life support, ACLS, etc. And every new nurse should complete a 2-day induction and orientation program before beginning their duties in the ICU. And decontamination and disinfection of the equipment and supplies after use is also our strength. And other strengths also include, we have staff meeting every month. We continue nursing education for nurses and doctors once a week. And we have yearly performance appraisal of the nurses. And we have the ICU registry, which helps us to record all the details about the patients who are admitted in the critical care unit. And other strength is fellowship in critical care nursing. It is started 2 years back to provide advanced specialized education and clinical experience for registered nurses who want to deepen their expertise in managing critically ill patients. And it's a 6 months course. And we have 2 fellows in each batch, and I'm one of the preceptor of the fellowship in critical care nursing. And our ICU nurses are very hardworking, and they are undergone continuous training to handle complex and critical cases with expertise. And they are also able to utilize advanced monitoring and life support technologies to improve patients' outcome in the ICUs. And they work closely with doctors, physiotherapists, and other professionals to deliver integrated care. Senior ICU nurses mentor new staffs, strengthening the entire team's skills. And we are also implementing the latest research to refine ICU protocols and patient care approaches. And our nurses are dedicated to excellence, resilience, and compassionate care in the most challenging healthcare environment. And I would like to give one of the example about our frontline heroes at COVID-19. Our critical care nurses gave their best, and they were the most hardworking nurses at our place at the time of COVID-19. And because of their hard work and their resilience, we have measurable improvements at our ICUs in the last 5 years. In the last 5 years, the survival rates increased from 60% to 80%, and complication rates in the patients decreased from 30% to 15%. The most common complications we face here are the ventilator-associated pneumonia. And the average length of stay reduced from 12 to 8 days, and the patient satisfaction improved from 70% to 85%. This is our biggest asset from our nurses and their hard work. And our nurses are also involved in research, as ICU nurses play a critical role in advancing healthcare through research. Their involvement in research enhances the evidence base for clinical practices, improves patient outcomes, and ensures that care delivery evolves in line with the latest advanced evidences. So currently, our nurses are engaged in 3 of the quality improvement projects, like alarm fatigue management in critical care nurses of Dhulikhel Hospital. We have already done the baseline survey, and we have already found out what is the level of alarm fatigue, and we are planning on the alarm fatigue management. And we are also planning to, we are also working on implementation of nurse-led delirium management protocol in critically ill patients. And in a collaboration with the International Institute of Critical Care Medicine in Mount Sinai Hospital, New York, the physicians from there in Nepal and the nurses in Nepal, we are also conducting a research in adaptation of a paired spontaneous awakening and spontaneous breathing trial to a resource-limited intensive care unit in Nepal. It's the baseline data collection has already been done, and we are working further on it. And despite of all the strengths and all the hard work our nurses are doing, we are facing some challenges like staff turnover and lack of trained personnel. Staff turnover is a problem not only at our place but all around the Nepal, because the trained nurses are giving the exams like NCLEX, and they are being recruited by Western countries. That's why there is a staff turnover, and we are recruiting the new nurses and who have the lack of training. And we do also have a few protocols, but we do not have many standardized protocol. That is also one of the challenges. And others are inadequate infection prevention and control measures, which pose risk to patient safety. And we do have inconsistency in the supply of medicine and equipment hinders effective treatment. And as Nepal is a resource limited country, and the financial constraint has always become one of the biggest challenges. Now I am here at the end of my presentation. I'd like to request you all for the question and answer session.
Thank you so much, Bhawana. You shared so much about critical care in Nepal in such a short time. As she mentioned, now we have the opportunity to interact and ask Bhawana any questions you might have. While you think about that, there is a Q&A box at the bottom. I will start by asking a question that comes to my mind. You shared about how the critical care nurses during COVID-19 pandemic did some remarkable work. Would you say, since the pandemic and the Year of the Nurse, have you seen a shift in culture in the critical care department? Have you seen changes in how nurses feel about the role? What have you seen shift following, or maybe they're burnt out and leaving critical care? What have you seen in Nepal with nursing following the wonderful work done during the pandemic?
Thank you for the question, Rebecca. After the pandemic at our place, the nurses, they are not leaving the jobs or they are not shifting, but they are quite motivated to work for the patients. So most of the nurses working in the wards and other units, they are interested to work in the critical care units. None of our staff from the critical care unit shift the work or left the work.
I love that. I'm very proud to be a critical care nurse or advanced practice nurse here in the US. And I know we're so excited to have people join our cadre. And I think there was a shift into that work. But then now in the US, I think we're seeing some people leave because now they're tired. And it is very hard work and admirable what you're doing. Mairead put a question in the chat. What would your priority be in addressing the various challenges? Like as the nurse manager for the intensive care unit and as the professor training the next generation of nurses, what are your priorities? Or I can ask a more specific question if that helps.
The main priority is training the critical care nurses and motivating them to continue the work in Nepal. But the problem here is the low paid work for nurses. That's why they are being migrated to the places where they are paid more. But what I think is if we train them more, and our government as well as Nursing Association of Nepal is also working on it, how to retain the nurses. So the main problem is the salary and hard work.
Yeah, we see nursing migration as one of the largest challenges for global nursing. Howard at the ICN, all of our Amelia at the WHO talk about it quite frequently in different capacities. And how many nurses from critical care do you see? Like, do you have a turnover rate that you have in your hospital, or do some leave every year?
I didn't get you, please.
For leaving to go somewhere to another country, do they leave every year, or is it just one, are you losing a lot of nurses to migration?
Yeah, we are losing a lot of nurses, 3 to 4 in a year, but it's because of the retrogression that is happening there. If the retrogression opens, then I think out of 55 nurses, 10 of them might have finished their NCLEX and they are ready to fly.
Mm,
So it's a biggest problem or a big problem in Nepal, not only at our hospital, but other hospital. And it is very common, or the critical care nurses are the ones who are living more.
mm. Because you do think it's because of their skill set?
Yes,
Mm. You're training them so well, Bhawana. You should be very proud.
yes, we are.
There's another question in the chat or in the Q&A from Mardo Cheval, who's one of our nurse anesthetists. How is your department currently battling the critical care shortage and or increasing your recruitment? What is the current training that you receive? Does everyone have the 6-month fellowship, or is that for, can you share a little bit about that?
Yeah, for the critical care nurses, we have two category of nurses. One is the with the bachelor's degree and with 3 years training after the high school. And for that, we provide 2 days basic for nurses in critical care training for all the nurses. 2 days,
Mm,
the nursing training, and later on, about 20 of our nurses might have the 3 months critical care nursing training. And
mm.
fellowship, it's a new. And most of our, only 3 of our nurses have got the fellowship training. But our plan is to provide fellowship to all our critical care nurses.
And is there, I guess the next question kind of leads into this. Is there something that you saw in the skill set of the nurses that you thought, hey, a fellowship would be a great option given the levels of education? Did it matter if they had a bachelor's or just the training after grade 10 for 3 years?
Mhm. What we see is the nurses who have done the bachelor levels of nursing, and if they get the training or the fellowship, they work better.
Mm.
We
Did you?
have trained both the bachelor level nurses and certificate level nurses or staff nurses, but the performance is better with the bachelor level nurses. So what we are planning is to put the bachelor level nurses, all the nurses in the critical care should hold the bachelor degree. That
Mm.
is in our future plan
Oh, wow. Yeah,
for critical care.
I think that's something that we did in the recent years. Is it difficult to get a bachelor degree in Nepal versus the certificate? Is it a real challenge in terms of accessibility for if you want to go and become a critical care nurse and you would have to get a bachelor's? What does that look like in your country?
Yeah, in our country, the management is willing to get the staff nurses rather than bachelor level nurses
Mm,
because they have to pay less for those nurses.
mm,
We have enough bachelor level nurses as assistant professor. We are also training the BSc nursing at our place,
mhm.
and we produce 40 nurses per year, but we are not able to hire those students or the nurses because we have to pay more for the bachelor levels. So we have limited number of bachelor level of nurses and more number of staff nurses.
I see. So there's a payment structure at your hospital where you're paid by degree, and
Yes,
certificate is paid less, so the hospital system can afford more nurses at that level versus
yes,
at the master's or bachelor's or master's degree.
yes.
Do you have nurse anesthetist in your hospital?
No, we don't.
You don't.
We have the trend. We have started fellowship in operation theater management,
Mm,
but we don't have nurse anesthetist. As we don't have advanced practice nurse at our place.
it's coming.
We are waiting.
Let's see. Does anybody else have any questions for Bhawana? This has been such a great. Oh, I see. Um, I see a few questions coming. Is there a lot of interest in nursing pursuing a bachelor's or master's degree? Do the
Mhm.
nurses you work with, do they want these advanced degrees?
Yes, the nurses want the degrees, but there is also a problem because when they have to join the bachelor's level or master's level, they have to leave their job, and after that, it is very difficult to find a job. But for Bachelor BSc Nursing, we enroll the students from high school in science. That's why we have a greater number of students in BSc Nursing.
Mm. If you have a certificate in nursing and you want to be a C, what is that process?
The certificate level nurses cannot do BSc Nursing. They have a different pathway that is called Bachelor in Nursing Science. We call it BNS.
And how
And
many, what does that
mhm.
look like?
Yeah, and in BNS, after 3 years of certificate level nursing, and they can join BNS. And BNS, it's a 4 years, 3 years of training and 1 year of internship.
Oh,
And we have very limited number of students in BNS because, as I already said, the certificate level nurses, if they leave their job, it is very difficult to find another one.
amazing. And I have another question for you in the chat from Mairead, who you met in Kenya last year.
Yes.
She's joined us. Do you feel the hospital's leadership and or the government supports the field of nursing? For example, are they providing incentives to retain their nurses?
Mhm. The government is not doing such programs, but my hospital, it is one of the hospital which pays more for the nurses. The
Mm,
salary at our place is maybe second or third in the whole country.
oh, wow.
It's high. That's why it's not a problem to recruit the nurse. But as I already said, to retain the nurse, it has been a challenge.
Absolutely. And then,
It's because of the global calling. You
mhm.
people are calling our nurses.
Yeah, I think it is a global calling. I'm
Yeah.
so proud to be a nurse. And then yeah, Mairead kind of elaborated and she said when we were in Kenya the past May, the nurses were talking about how the government was exploring reducing their pay, which was prompting more nurses to look at leaving the country. So that was one of the things that our colleagues were dealing with there. Is there any kind of turmoil in the world of nursing in Nepal? Is there any
Mhm.
challenges like that happening?
No, no, not such. But one of the new step taken by our government, the government has signed a contract with UK, the government of UK,
Mm,
United Kingdom, that we are sending the 110 nurses to their country. That is the new thing I know about it. The government itself is sending the nurses to other countries.
such a challenge for nursing migration and maintaining the health of our own countries.
Yes, yes.
But
And one of the biggest fear is when I become old or when I become sick, I may not get a nurse to take care of me.
yeah, I think that's really reasonable. Wow,
Yes.
it's been really so wonderful to have you here today in 30 minutes. I feel like we got such an amazing insight into your world. Thank you for all that you do to develop nursing and to train the next generation. I'm excited that CGN will be visiting that hospital in Zulukal in the beginning of next month. As we move forward, kind of working with Bhawana and her colleagues. And so thank you everyone for joining us this morning. We are so, and this evening, depending on where you are, we are so glad to have you. Please check our website. We'll have the recording in case you missed some of this presentation. We'll also be excited to share our speaker for next month, where we're going to learn about midwifery in Africa. And thank you so much, Bhawana, for your time. And everyone have a wonderful, wonderful day. Namaste.
Thank you so much, Revika, for this opportunity. Thank you.
Yes, have a great day,
Thank you,
everyone. Thank
everyone, for
you.
listening to me.